The Ebola epidemic brought fear and death to West Africa in 2014. Of the more than 18,000 cases, around 6,500 were fatal. It was in impoverished Guinea that the current outbreak began a year ago. 6 months later, it had spread to neighbouring Liberia and Sierra Leone. The initial response from the World Health Organization and international community at large was widely judged to have been too slow, but efforts have visibly ramped up since then. Preventative measures and medical assistance on the ground are currently the only options to eradicate the disease.
Our best bet right now is to count on behaviors, attitudes, community mobilization, treatment, safe and dignified burials, and then strengthening the systems, the health systems as well as the community systems, so that in the mid and long term, we build the capacities to resist further shocks when they come around.
The opening of new treatment centres, as well as strict public health measures, seem to be bearing fruit. In Liberia and Guinea, the situation has stabilised, with the number of weekly new cases dropping from 500 to 200. But Sierra Leone paints a bleaker picture. 500 cases were reported last week alone. Nonetheless, 2015 offers hope of new treatments and vaccines. 3 major pharmaceutical firms are touting new products, and though they're still at the experimental stage, they could lead to an effective cure for Ebola.
If you had a fully effective vaccine that completely protected on a large enough scale, then that should be enough to stop transmission, as we see for many infections that we have childhood vaccines for, if enough people are protected against it. And remember, of course, that Ebola, the transmission rate is lower than for other infections, so it wouldn't be necessarily that we have to vaccinate the entire population to stop these transmission occurring.
Until any such treatments can be widely distributed, it will be up to aid groups to continue their efforts in the field. Ebola hasn't yet been contained, and UNICEF recently requested an extra $500 million to help stop the virus spreading further.